So your neck and posture. So why does posture even matter? What even is in the neck? And what are the things in the neck that end up giving us pain? So I have a neck model here to kind of give us an idea of what we're looking at. So when we think of our neck, we have the deepest layer of the bones, right? We have 7 cervical bones starting at the top. 1, 2, 3, 4, 5, 6, 7. Then this is the skull up here. If I turn to the side, this is the back side. If I turn to the side, I can see that I also have in my neck, I have these yellow are nerves. That's where the nerves come out. I have the red, that's the artery that runs down through these little holes. And then if I rotate again, looking from the front, these are the discs in between each bone. So if you look at this from the side, you can see how these bones are stacked on top of each other like Legos or like puzzle pieces, and they're very specific in the way they fit together. And every spot in these bones that come together or meet has several joints in between each bone. So we have the disc here. Then we also have 2 sets of other types of joints on each side of that disc joint. So here's one of them. So right in here, you can kind of see how this is kind of like how those 2 Lego pieces fit together, right? That's called the facet joint. Now, the way this all fits together, there's a hole there where that nerve comes out. And if you can see, there's not really a whole lot of room for space there. So if this neck isn't flexible and it's going to stay in this straight position, right? So it's not going to show me how that space closes down. But if I take this guy and it's harder to see the spaces on this one because it's so broken down, but you can see there's the space where the nerve comes out right there. Okay, you can kind of see that going up and down. His nerves are long gone, but those holes there, that's a good view. That's the foramen, they're called. They're holes that the nerve comes out. Now if I rotate a little bit more, you can see again where those facet joints are. Right there. Okay, so a couple things happen when we have bad posture. So this is a pretty straight position with a slight curve in the neck. Now, if I slouch, which is going to be like this position, slouched, and the neck goes into extension and the lower body goes into flexion, I'm going to put this guy in what would be like a slouched position of the neck. And that looks exaggerated, but it's not really. When I'm slouched like this, that's what that looks like. So if I look at these spaces, you can see how this space gets smaller, and it's much harder for the nerve to come out. And look at these joints. These joints are just crammed down together, jammed up together. So the point of that is to kind of give you a visualization of what happens when we slouch. So not only do we crunch down those joints, we close down the spaces where the nerves come out. That's what happens to the joints and the nerves. And then the other thing that happens is it puts our muscles in a poor position for function. So muscles are supposed to be in kind of just like the joint, they're supposed to be in the mid position, is its ideal position to function properly. So if we're slouched, then we're gonna get muscles some of the muscles will be in a short position. The ones on the back of my neck are gonna be in a short position, which tends to make them tight and stiff. And the muscles in the front that will be lengthened, and usually lengthened muscles get sort of turned off and they're not as activated. So by slouching, we put the joints at risk in compression, we close down spaces where the nerves come out, and we put the muscles in a disadvantaged position, which can end up giving us issues on all of those tissues, issues on tissues.